Good morning, everybody. My name is Marty Mascari. I am a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. I'm hearing the feedback. Sorry, but it just went off. I'm sorry. But I am a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC, both of which are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. Welcome to you all. We are joined here by several people with the Area Agency on Aging. Melinda Gardner, we've got Simon Manrique, we've got Sheila Warner, and the head of the Area Agency on Aging, Donnie Green, is with us today. We also have Angel Hanzik with the Better Business Bureau Education Foundation is joining us as well. But before we get started with the webinar, we're going to first talk about CEUs, if we could. For those of you that are joining us for CEUs, we're offering complimentary CEUs for licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas or you have a license outside of Texas, you're more than welcome to go through the process and get a certificate and submit it to your jurisdiction. But please note there's no guarantee that they will take that, although I've had people tell me they've been able to use them. In fact, I've even been contacted by jurisdictions from time to time asking for more information about the webinar that took place. But you're more than welcome to do that. We're also offering certificates of attendance. The guidelines are the same. Today's webinar is worth 1.5 hours of CEU credits. You must complete the entire live webinar and the Q&A and hang on with us until 11:30. If you have to go and we go past 11:30, that's understandable. You can do that, but you must hang on to us on with us until we complete it, or at least till 11:30. You must also complete the Google evaluation survey. It will give you an opportunity. It should give you an opportunity to go there right as you close out of Zoom. It should ask you if you'd like to take a short survey. That will open up our Google survey. But if you don't get that when you close out, have no fear. That will also be mailed out to you in a follow-up email that will go out tomorrow morning. The survey will be open until the 17th. And then please give us about 4 weeks after that to get certificates out to you. If you don't get it by then, please feel free to reach out to me and we will look into it. I'm going to turn it over to Melinda, I think, and let her move us forward this morning. You're on mute, Melinda, just so you know.
Why would I be on mute? I don't want anybody to hear me. Anyway, thank you, Bernie, for coordinating our midweek Medicare. And thank you all for joining us. Today, we're going to talk about a couple different things, and we have some bonus information to share with you later. But before we get to that, Simon Manrique is going to provide information on from Marketplace to Medicare. Simon is a benefits counselor with the North Central Texas Area Agency on Aging and has been with us for 5 years. Is that correct, Simon? 5 years. So we're going to turn it over to him to give us information on Marketplace to Medicare. And you're on mute.
Yes, I am. Getting all these screens moved around causes that. Sorry about that. And again, my name is Simon Manrique, and I want to thank you for being here today. And also, sometimes we don't get it told or recognized, but thank you for what you do. And I'm one of those individuals when people ask me what I do, I really get excited because I really enjoy doing what I do and working with the individuals that I work with. But anyway, yeah. So today's presentation is going to be going from the Marketplace to Medicare. And we are the Area Agency on Aging of North Central Texas, and we are a program of the North Central Texas Council of Governments. We are also known as CHIP, which is the State Health Insurance Assistance Program, which we'll go into explain a little bit more into it here in just a bit. We also will partner with the Texas Senior Medicare Patrol to provide information on fraud and abuse. And we're co-presenting with Angela Hansick today, who will share information about outpatient mental health fraud. Also, I wanted to let you know that we do have individuals here that speak Spanish. And so if you ever get anyone in that situation, as far as speaking Spanish, we do. I do. Yo hablo español. And but yeah, just to let you know. And I want to thank you for taking time out of your busy week for this midweek Medicare. I know it's fast hump day and it's almost Friday, which means the weekend is coming up. And this is also wanted to show you or tell you about our benefits counseling team. As you can see, there's my name with my extension. We also have Felicia Warner, Leslie Kilton, Dolores Purvis, and our fearless leader, Ms. Melinda Gardner. And really appreciate my team, and we all try and work well with what we have. CHIP, like I was saying, I was going to tell you a little bit more about it. CHIP is a federally funded program in 1990 under Section 4360 of the Omnibus Reconciliation Act. The CHIP program was established by Congress, and their work is funded by the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. Next slide. Okay. ALC manages the State Health Insurance Assistance Program, or CHIP, and CHIP provides unbiased help to Medicare beneficiaries, their families, and caregivers. Working with the state offices, local agencies, and community providers, CHIP establishes community-based networks for counselors who provide assistance in person and by phone. And we make group presentations and use a variety of media resources to educate people about Medicare. When a beneficiary contacts their local CHIP, a certified counselor will give them one-on-one guidance based on their unique situation and needs. CHIP helps with understanding cost and coverage, comparing options, and completing the enrollment process. Depending on your area, you may know your local CHIP representative by another name, but the support it provides is the same. We're certified Medicare counselors that provide in-depth, individualized counseling, educational presentations about Medicare. And as far as local can mean libraries, community centers, medical settings, area agencies on aging and disability resource centers, and anywhere people gather either by phone or even online, which we're starting to utilize greatly nowadays because we're able to have that opportunity to talk to individuals online. We do have our local CHIP, or you can find your local CHIP, excuse me, through visiting this website, which is the chiphealth.org. The CHIP TA Center serves as a central source of information, expertise, and technical assistance for grantees. The TA Center disseminates knowledge and best practices through the development of new products and tools, provides one-on-one assistance to the network. They also host the CHIP Locator. To partner with CHIP in your community, visit the chiphealth.org. Roughly 40% of contacts occur during open enrollment period, which is the OEP. So we anticipate that capacity may be reached early. So if you'd like to partner with your local CHIP, please reach out soon to learn more about how they are offering services at this time. Yeah, next slide. Just to give you a snapshot, there are 54 CHIPs, one in every state, including Puerto Rico, Guam, DC, and the U.S. Virgin Islands. There are about 2,200 local programs. There's 12,000, I believe now, as of now, it's over 12,500 counselors. We do over, between everybody, we do over 4 million individuals. So we have educated over 4 million individuals, and we have done 2.5 million counseling sessions between all the CHIP organizations. Just making sure. Okay, the next slide. This is one of our many flyers that we utilize to communicate with the many different communities that we work with here at the North Central Texas Council of Governments. And I go to different facilities. I've been to some of the senior centers in the 14 counties that we work with here in this area of the North Central Texas. And this is one flyer that I like to carry with me, because a lot of times, believe it or not, I just can't believe how often individuals come up to me and say, "You do what? And since when have you been around? And how come I've never heard about you here?" And I give them this flyer and I let them know. This gives you a broad scope of what we do. Next slide, please. And of the different services that are available. And I like the fact that we service, so there's free services for people of all ages and disabilities, and even the family caregivers. That's one thing that I've been getting a lot of surprise responses from family caregivers, because there's a lot of individuals out there that are taking care of their family themselves. Next slide. Okay, so with the CHIP there, and even with us with the North Central Texas Council of Government, there are volunteer opportunities that you can assist. We have Sharon Rothbottom. She's our volunteer coordinator, and these are some of the program opportunities that are offered. Benefit counseling, which help with public and private pay benefits, entitlement programs, and legal rights. There's also Senior Medicare Patrol, which help prevent healthcare fraud by conducting community outreach and education services. Long-term care ombudsman, they protect the rights of nursing home and assisted living facility residents. And then, of course, taking control of your health evidence-based programs. They're based on a rigorous study, and these programs help participants better manage chronic conditions and reduce risk of falls. So these are some of the programs that are available where you can help with. Next slide, please. Some of the volunteer positions, the benefit counseling, the senior medical patrol, the long-term care ombudsman, and taking control of your needs. You can select opportunities that meet needs and goals, consideration for skills and interest, and your schedule. Okay, this is how and when you can serve. Okay, serve in the North Central Texas. Again, we cover the 14 different counties in our area. You can undergo free service training. There is a clear background verification, and then you are going to be able to receive continuing education. And then, of course, you will be complying with program requirements. And again, the individual here with us that helps us with the volunteer, she's our volunteer coordinator is Sharon Robine. Next slide, please. All right, here we go. Now that I've got all of that big old introduction out of the way, Marketplace to Medicare, what can you expect? This session focuses on the health insurance marketplace, sometimes called just the marketplace or the exchange, and what people with Medicare need to know for the Medicare enrollment, eligibility information. You can review Getting Started with Medicare at the CMS National Training Program.cms.gov website. This training was developed and approved by the Centers for Medicare and Medicaid Services, the federal agency that administers Medicare, Medicaid, the Children's Health Insurance Program, and the Health Insurance Marketplace. This is an informational resource for our partners, and official Medicare marketplace program legal guidance is contained in this health insurance marketplace, and it is a registered service mark of the U.S. Department of Health and Human Services. Okay, this section, we will be addressing these questions. What should you consider when deciding to enroll into Medicare Part A, which is the hospital insurance portion of the Medicare coverage, and Part B, the medical insurance? So a lot of times I refer to this as the doctors and their services. That's what Part B covers. But, and this is also, when must you enroll in Medicare Part B, and what else should you consider when deciding whether to enroll or not into Medicare? And then what should you know about Medicare enrollment periods, and what factors and when you should consider keeping your health insurance marketplace plan instead of Medicare? Another important thing is, how do you cancel your marketplace plan? The marketplace open enrollment notice informs you that you may be eligible for Medicare and can change your healthcare coverage when you turn 65. There are different ways to sign up for Medicare, and there may be late enrollment penalties if you don't sign up when you're first eligible for Medicare, and that you may cancel your marketplace plan when you sign up for Medicare. What to consider when enrolling into Medicare Part A hospital insurance. Most people don't pay a premium for Part A because, again, when you're talking to Social Security will indicate if you have the 40 necessary credits so that Part A is free. And usually they can tell you if you worked at least 10 years of your life and you accumulate the 4 credits from each year, 10 times 4, 40, so you get your 40 credits. And another thing that you need to consider when enrolling into to Medicare, that you can no longer contribute to a health savings account if you have Medicare. If you decide to delay enrolling into Medicare, make sure to stop contributing to your HSA at least 6 months before you plan to enroll into Medicare. When you enroll into premium-free Part A, you get up to 6 months retroactive coverage up to the month you are first eligible. And if you don't stop HSA contribution at least 6 months before Medicare enrollment, you may have to pay a tax penalty. If you're not eligible for the marketplace premium tax credit and stop sharing the cost sharing reductions that lower your marketplace plan through co-payments and co-insurance when you qualify for the premium free Part A. So you need to be very careful with that when you're coming from the marketplace into the Medicare. If you have to buy the Part A premium and don't buy it when you're first eligible, your monthly premium may go up 10% for every 12 months that you didn't have the coverage. You'll have to pay the higher premium for twice the number of years you could have had Part A, but didn't sign up. So Part A and even the Medicare Advantage plans is considered qualifying health coverage, because that's one of the things that they do want us to do. They want you to have credible coverage for your medical services. What is considered enrolling into Medicare Part B or medical insurance? It says you should consider when deciding to enroll into Medicare Part B, which again is the medical insurance. Most people pay a monthly premium. Almost everybody that's in, once you come into original Medicare Part B, like this year, the Part B premium is $174.70 a month. And again, I reiterate, that's what it is for this year. So you have to kind of be sure that you're finding out what the monthly Part B premium is, okay? So most people pay that monthly Part B premium. It's usually deducted monthly from your Social Security check, or if you're with a Rural Retirement Board or a federal retirement payment, the amount depends on the income from 2 years ago. Believe it or not, there's some individuals that do have a high income, and they are informed of the normal, if you want to call it, or the regular monthly premium, which is the ones which again this year was $174.70. And then all of a sudden, because of their income, they are told of a higher amount. And of course, that has a lot to do with their income from the 2 years ago. So that can also play a part with them. How you can pay that monthly premium? You can pay online through your secure Medicare account by using your credit card or debit card. You can pay directly from your savings or checking account through your bank's online bill payment service. You can sign up for the Medicare Easy Pay, and you can visit the Medicare.gov website for that information, or you can mail your payment to Medicare if some people still like to mail in their payments. You don't have to sign up for Medicare Part B, but if you get into it later, you may have to pay a lifetime late enrollment period penalty, which is added to your monthly Part B premiums. People who don't get a retirement payment or whose payment isn't enough to cover the premium get a bill from Medicare for their Part B premium. The bill can be paid, again, by credit card, check, or money order, and you can also pay your bill online through your Medicare account at the Medicare.gov website. Next slide. Sorry. Enrolling into Medicare, there is automatic enrollment. If you're already getting Social Security or the rural benefits at least 4 months before you turn 65, you'll be automatically enrolled in Medicare. You'll get your initial enrollment period package in the mail along with your Medicare card, which is usually about 3 months before you turn 65. Coverage begins the first day of the month that you turn 65. Okay, the next slide. You want to go to the next slide? All righty, thank you. Again, enrolling in Medicare, your initial enrollment period, if you're not getting Social Security, at least 4 months before turning 65, you can sign up for the Part A and the Part B during your initial enrollment period. The initial enrollment period, it starts 3 months before your 65th birthday, including your birthday month, and ends 3 months after your 65th birthday again. So you have 3 months before, which is 3 months. Yeah, and then you have the actual month of your birthday, and then you have 3 months after, which is a total of 7 months. And again, you're going to enroll with the Social Security or either the railroad benefits program. And then coverage begins based on the month of your enrollment. Some individuals think it's like, even though your birthday's on the 28th of the month, they think, so my coverage is not going to start till the end of the month. No, it is effective on the first day of the month of your birthday. Next slide. Okay, there you go. What if you miss your initial enrollment period? You can only sign up again to Medicare during certain enrollment periods. If you don't sign up for Part B or Part A during your initial enrollment period, you can sign up during the Medicare general enrollment period. For most people who don't sign up during their initial enrollment period, this is their only chance to sign up. The general enrollment period occurs each year. It begins January 1st and ends March the 31st if you enroll in the general enrollment period. Your coverage will start on July the 1st, and this is required by law. Again, got to be very, very careful when your initial enrollment period, because I can't tell you how many times we've gotten calls, or I've gotten calls, where individuals are still working and they have coverage through their employer group health plan, and they pretty much decide, hey, I've got the coverage that I need, and decide I don't want to get into Medicare, because a lot of times they think by getting into Medicare, that's also when your Social Security benefits take effect, and don't want to touch their Social Security benefits. So it's almost easier for them. I'm working, I got my insurance coverage, I got all I need, so I'm going to leave everything alone. And sometimes that can come back and bite you in the arm. So you want to be very, very careful when talking to individuals and explaining to them about the general enrollment period, about their initial enrollment period. Okay, again, note, effective January 1st, 2023, people who enrolled in Medicare Part B during the last 3 months of their enrollment period or during the general period will have coverage starting the month after enrollment. Okay, next slide, please. Because like I said, some individuals are having not necessarily coverage through their employer group health plan, but they have coverage through the marketplace, and they are coming into Medicare. It's very important that you look at canceling. They look at canceling their marketplace coverage due to the Medicare eligibility. Ending marketplace coverage due to the Medicare eligibility is different depending on who is ending coverage, if it's by yourself only, or if it's if your household is in this in the marketplace coverage also. Again, this is for the federally facilitated marketplace states who use healthcare.gov for the marketplace. Okay, so again, we get calls like that. So, is my husband or is my wife going to be with me in this Medicare? And because that's the way it's been before. And, before you came into Medicare, you could, as the individual that had a job and that had the insurance coverage, a lot of individuals think, okay, so I'm going into Medicare. Will I be able to take my spouse? Will I be able to take my children into the Medicare? And that's one of the questions that I get. And so you have to break down, no, you are an individual for yourself as far as Medicare. And then your spouse, if she's not, or they're not into 65 yet, eligible for Medicare, and then your children, you're going to have to set up something differently separate from you going into Medicare. So very important to take a good look at all that information for them. The next slide, please. Canceling your marketplace coverage. Canceling your marketplace coverage, you can request that your coverage ends immediately, or you can request a date in the future. In some cases, your coverage won't end immediately. For example, when the household members who remain enrolled in the coverage qualify for an SEP. SEP stands for a special enrollment period and must re-enroll. You can end the marketplace coverage by logging into your healthcare.gov account if you're the only one covered, or by calling the marketplace call center, and you can see the phone numbers the phone number there that you can call, and you can go ahead and, to cancel the coverage with your marketplace, since you will be coming into Medicare. So again, call the marketplace center. If you have a household plan, again, you're going to call the marketplace center on the day that you want the members' coverage to end. Don't change or end the marketplace coverage online unless you're ending coverage for everyone on that particular plan. Again, you have to be very careful with that. And in most cases, the removed members' coverage will end right away. So you need to again, just can't reiterate how important that is, to pay very close attention to that when you're helping the individuals coming from the marketplace to Medicare. Next slide. If you have a marketplace plan, you can keep it until your Medicare coverage starts. If you'd like, you can keep your marketplace plan too, but once your Part A coverage starts, your marketplace coverage duplicates the coverage you would get from Medicare. you no longer qualify for the advance payment of the premium tax credits because depending on your income, what you're actually paying for your marketplace plan sometimes is less. And so you lose those tax credits once you become eligible for Medicare or other cost sharing that you may be getting from your marketplace plan. So you'd have to pay full price for your marketplace plan once the Medicare becomes effective. Medicare doesn't coordinate benefits with the marketplace plan and doesn't work as a Medicare supplement insurance like the Medigap, what we refer to as Medigap plans coverage, or it's not a secondary coverage either. A lot of individuals think that the Medigap or the Medicare supplement insurance coverage is secondary, and it's kind of like it, but it's not really a secondary. So you need to be careful with the terminology that you use. I know I run into that problem a lot with the individuals. You know, they say, "Hey, I've got Medicare, but I want a secondary insurance or a supplement." And that supplement to them, a lot of times, they understand it to be like a secondary insurance. So you need to be very careful with the terminology and the way they understand it so that you can help them properly. There's little to no benefit in keeping the marketplace coverage once you're eligible to enroll into Medicare. And it's best to sign up for Medicare and drop your marketplace plan when you become eligible for Medicare. If you're not eligible for premium-free Part A, you can choose to keep your marketplace plan to get your coverage. That coverage may cost less, but again, you just need to help the individual to make sure they look at their options and what kind of coverage they have. Next slide, please. Keeping your marketplace plan instead of Medicare. Situations when you can keep your marketplace plan with the premium tax credits. If you're eligible for Medicare but haven't enrolled because you'd have to pay a premium for Part A, believe it or not, there are some individuals out there that didn't get those 40 credits because they didn't get their 40 credits. They're having to pay for a Part B premium. So a lot of times they may have a medical condition that qualifies them for Medicare, like the early stages of renal disease, which is the ESDR, but haven't applied for the Medicare coverage, or if you're in your 24-month disability waiting period. Also, if you're enrolled in Medicare and you're paying a premium for Part A, again, it may be a time that you may want to consider keeping the marketplace plan. Or if you only have Part B and you won't have to pay a premium for Part A. Next slide. Considerations. Some of the considerations again here. The marketplace plans may not pay claims that would be covered by Part B if you're eligible for Part B but didn't sign up. So just be careful with that when you're explaining this to them. If they delay signing up for Medicare and decide to sign up at a later time, but remember, you'll need to sign up during the general enrollment period or a special enrollment period if they qualify. Be responsible for a lifetime Medicare Part B late enrollment period. I've had an individual that did get a late enrollment period. In particular, it was because of the prescription drug coverage. They didn't enroll into a standalone prescription drug plan in a timely manner, so they got the individual wound up in the hospital, needed to get some medications, went to their favorite pharmacy, and then the pharmacy told them that the particular medications that they needed were not covered. And they were like, "But wait, I've got this card. Isn't this my prescription drug coverage card?" They're like, no, that's only a discount card. It wasn't what Medicare refers to as credible prescription drug coverage. So again, need to be very careful with them when if they don't enroll when they're supposed to because of that late enrollment period. Another thing is if your Medicare is ended retroactively, you'll have to pay back any claims that Medicare paid during that time. And there's likely not much benefit to choosing a marketplace coverage instead of Medicare at that point in time when you should be on Medicare. Lesson 2, programs to help you pay for Medicare. One of the best ones that I see that I always like to talk about is the marketplace savings programs. And again, if you're transitioning from the marketplace to Medicare coverage, you may be concerned because you get premium tax credits on the marketplace to help with the premium cost, and you'll lose them when you qualify for Medicare. You can get help from your state paying for the Medicare cost if you have limited income and resources. These programs frequently have higher income and resource guidelines than full Medicaid and are helpful if you had premium tax credits or cost sharing reductions in the marketplace. These programs are collectively called the Medicare Savings Program and include the Qualified Medicare Beneficiary, which is QMB, the Specified Low-Income Medicare Beneficiary Program, which is the SLMB, and then there's the Qualified Individual and Qualified Disability and Working Individual programs. Eligibility for these programs are determined by income and resource levels. These income amounts are updated annually with the federal poverty level, and many states configure your income and resources differently. So if you have income from working, you may qualify for benefits even if your income is higher than the program limit. So their income is what's going to play a big part in these programs. I know here in the state of Texas, it's a little some of the Medicare savings or the Medicaid aspect of things is a little bit different than some of the states. I've gotten individuals that are coming from California, and they were doing good in California or even New York, and they were doing good up there. And then they come to Texas, and well, Texas is a little bit different as far as I'm going to say in that regard. Okay, but still, I'm glad these programs are available to those individuals so we can help them to try and get the Medicare coverage that they need and help them with the cost of this. Another program is called the Extra Help for Drug Cost. Extra Help is a program to help people with limited income and resources to pay for their Medicare Part D program costs, like their premiums, their deductibles, and co-insurance. It is also known as the low-income subsidy, LIS. And yeah, I get calls and individuals tell me, hey, I need help with my LIS, low-income subsidy. So if you hear the term LIS, do know that they're talking about the Extra Help program. Extra Help or low-income subsidy can help them again pay for their Part B cost. For lowest limit income and resources, usually you will not pay for your Part D or your standalone prescription drug plan premiums or deductibles, and you'll have small or no copays. A lot of individuals ask me, how much am I going to pay for your medications? I never like to tell them that you're not going to pay anything at all. I always tell them, if you qualify for this program, the cost of your medications is going to be a lot less than what it normally will be. So I said, but again, it just depends on where you are and what's available in your area. And but that's what the Extra Help does. It does help with the cost of the medications. Next slide. As far as qualifying for the extra help, you automatically qualify for the extra help if you get full Medicaid coverage, or if you get SSI, which is the Supplemental Security Income, or if you get help from Medicaid paying for your Medicare Part B, which is the medical insurance premium. And a lot of time, again, that help will come from the Medicare Savings Program or MSP. But again, if you must apply, you can visit the SSA.gov website. You can call Social Security and ask for the application for the help with the extra help, or you can contact your state medical assistance Medicaid office, or work with your local organization. Again, CHIP, the State Health Insurance Assistance Program, which is us. You can apply to find out if you qualify. If you think you may qualify for the help with your Medicare costs, review the income and resources guidelines. Collect your personal documents like your Medicare card, your verification, any verification of ID and residence and income, because that's going to be part of the information that's going to be needed to see if you qualify for this help. But I think the main one, as far as here with us, is the income seems to be a big factor, and of course also assets is one of the things. Some individuals do have a low income. They are under the income limit. But then they have high assets, they have $100,000 savings, or they have $30,000 savings, $50,000 savings, and those savings or assets can make a big difference. So you need to be careful when you're getting information from them in regards to that. Lesson 3, the Medicare periodic data matching. This section is on that, and it's what the PDM is, what's new for PDM, which is again the periodic data matching, and what the PDM process is. You'll be notified during this time. You'll be notified by the marketplace if you have Medicare and a marketplace plan and you're getting the premium tax credits and or cost sharing reductions. Medicare PDM notices will include your name, a recommendation that you should end your marketplace coverage, instructions on how to end the marketplace coverage or the marketplace financial help if you're signed up for Part A or a Medicare Advantage plan. That date that you must reply to the notice before the marketplace takes action on your behalf, and where to find contact information to confirm if you're eligible or if you have any questions about Medicare. Next slide. The marketplace will end premium tax credits and the cost sharing reductions for you if you're enrolled and in Medicare and the marketplace. Every once in a while, I know I've gotten calls where individuals have enrolled into Medicare and didn't know that they needed to get out of the marketplace, and they're trying to get both the Medicare and the marketplace at the same time, and kind of just have to notify them again. Nope, it's going to be either or. You're not going to be able to have both of them. The federal marketplace added will add a statement to the application to act on your behalf to end the coverage. So again, they do work in conjunction with each other as far as trying to communicate as best they can to let each other know if you're on the marketplace and you're on Medicare trying to get the marketplace plan that you're on, notifying them that, okay, this individual's on Medicare, enrolled in Medicare now, so the marketplace coverage needs to terminate. So they will get notified by it. One of the biggest things that I know in talking to individuals in reference to this, the notifications, their address, their contact has to be updated in order for them to get these notifications. But again, I know the plans do talk to each other, and the plan will let you know also. And again, you will get some material in the mail in regards to this, okay? If you have both Medicare and a marketplace plan, you have 30 days from the date on the notice to return to the marketplace to either end your premium tax credit cost, the sharing reductions, or to end the marketplace plan. You'll get specific instructions on your PDM notice based on your Medicare enrollment status. You'll also have the option to disagree with the results of the Medicare PDM notice if you think you're not enrolled in Medicare yet, or change your response from agree to disagree if you no longer want the marketplace to end your coverage at that point in time. And here are the different ways that you can connect with the marketplace. You can get updates by email or text by signing up at the healthcare.gov/subscribe, or here's the Spanish version of that, the cuidadodesalud.gov, ES escribe. And then, of course, there's the infamous Twitter that you can use, Facebook, all of these social media types of way to get the information that that you need, that they need to be able to understand what's going on, what they're going to need to do because they're on the marketplace and switching into Medicare. But I think the greatest information they can get can come directly from us. And again, I get excited being able to let them know about this, because a lot of times, a lot of individuals I can't have called and said, you know what, in the marketplace, I'm going into Medicare. I don't know which way to go. I don't know whether to go up or down, east or west. Okay, calm down. No problem. I got you. Let's look at what's there. Let's look at what you have, and give me an opportunity to explain what your options are, and then go from there. So, yeah, I'm glad you do what you do. Again, healthcare.gov is the official government website for health insurance marketplace. It helps you to find the health insurance best suited for your needs, whether it's private insurance for individuals, family, and small businesses, or public programs that may work for you. Again, because individuals may still need the marketplace coverage instead of the Medicare. So here's some additional information that you can get them, or how to be able to get to them. These are some of the websites that are available. These are information. There's quick start guides. There's the 1095 and tax information that you need. What premiums you might be paying, and then also again to find the local help that you may need to get any additional information that you may need. Next slide, please. Find local help. This is to get help to apply and more. You can search for a local agent broker or a sister, or get contacted by a local agent broker to help you to help them to get the information that they need. You can direct them to these places also, okay? Boom, and then here's the marketplace.cms.gov website. The marketplace is the official information source for assisters, navigators, certified application counselors and other partners that help health insurance marketplace consumers. You can get up-to-date information to help you counsel people who may benefit from the health insurance marketplace at the marketplace.cms.gov website. There's access to consumer materials, training materials, including videos, research, and more. And you can sign up for updates as well. This is also where organizations can apply to become certified application training information for navigators and certified application counselors is accessible for this webpage. Next slide, please. Some of the key points to remember. Very, very important, and that's kind of why I highlighted these points. Medicare is not part of the marketplace, or vice versa. The marketplace is not part of Medicare. Most of the time, if you're 65, it's best to have Medicare. If you have premium-free Part A and keep your marketplace plan, again, you must pay the full price for your marketplace plan, because remember the credits that individuals get sometimes because their income is not very high, so they get credits through the marketplace plans. You may need to return to the marketplace to end your premium tax credits, and you may have to pay back all or some of the premium tax credits paid on your behalf for months of overlapping coverage. Again, either Medicare or the marketplace. If you don't enroll in Part A, if you have to buy it, and Medicare Part B, during your initial enrollment period, you may have a late enrollment penalty when you finally decide to enroll into the Medicare. A gap in coverage if you have to wait until Medicare general enrollment period, because remember, general enrollment period, January 1st to March 31st, but then you become eligible, or your coverage for Medicare doesn't start until July the 1st. So again, you may have to pay back all or some of the premium tax credits you got after becoming eligible for premium-free Medicare Part A. And again, here's something that I highlighted in red. Timing is important when canceling your marketplace plan. Very, very important. Please just note, if there's anything you can do to remind you and to let them know. Timing is very important. If you already have Medicare, you probably can't enroll in a marketplace plan anyway. So just keep that into consideration. Again, I really enjoy what I do, and I enjoy the opportunity to help individuals, giving them the information that they need. And if you have any questions, please don't hesitate to call me. Don't hesitate to call us. Again, I'm with the North Central Texas Area Agency on Aging. If you have any questions directly for me, you can call me at this number at that 800-272-3921. My extension is 45687. Individuals sometimes ask me, how come it's not 45678? I don't know. They didn't give that to me. But anyway, it's 45687. Y si al caso necesito un poquito más ayuda, yo hablo español. So thank you so much for listening. Thank you so much for your attention. Thank you so much for attending. And y'all will have a great day today now.
Thank you, Simon. That was great information. It was a lot of information, and it made my head spin. But transitioning from marketplace to Medicare, it can be overwhelming, and there are costs that people may not be aware of. And since it's overwhelming, it could also affect our mental health. So today, we have some bonus information because it is Mental Health Awareness Month. And so we're going to give you information on behavioral health integration services and mental health care outpatient, what it is, why it's so important, what's covered, and also a local program that may be available to you. So mental health is a topic of conversation that often gets swept under the rug because nobody wants to talk about it. but mental health is important, and it's important that people deal with it. The subject that is often met with stigma, misunderstanding, yet it is an incredibly important aspect of our lives that we should all be paying attention to. It has more to do with specific actions people take. It's about how we respond to various scenarios. Two people who may experience the same thing may react to it differently. We think about maybe losing loved ones. Everybody deals with grief, but they deal with it in different ways. So Medicare can pay for a healthcare provider to help you manage your care for behavioral health conditions like depression, anxiety, or another mental health condition. And some healthcare providers may offer care management services using the psychiatric collaborative care model. And we'll explain that also. The psychiatric collaborative care model is a set of integrated behavioral health services that includes case management, care management, support, and that may include the following. Some of them include ongoing assessment of a condition, medication support, treatments that your provider recommends, or your healthcare provider can ask you to sign an agreement for you to get this set of services on a monthly basis. Now, you will have to pay some costs, but Medicare does cover it under Part B, and the deductible and coinsurance does apply. Also, depression screening once a year is included, and you must get the screening in a primary care doctor's office. And then there's also individual and group psychotherapy with doctors, as well as some other licensed professionals that are available through mental health care outpatient. Now, behavioral health includes the emotions and behaviors that affect someone's overall well-being. But behavioral health is something also called mental health and often includes substance abuse. But mental health, on the other hand, has more to do with thoughts and feelings. There's also family counseling that is included, testing to find out if you're getting the services you need. Also, again, medication management, certain prescriptions that aren't usually self-administered could be included. Diagnostic tests, intensive outpatient program have been added as of this year. And you get a one-time welcome to Medicare visit, and this will include review of possible risk factors for depression. And there's a yearly wellness visit also that will update that information. Part B also covers outpatient mental health services, as part of substance abuse disorder. So if you know someone that's in crisis, or you yourself may have a crisis, you can call or text 988, or you can chat through the 988 Lifeline website. That's 988lifeline.org. And now we are going to have a special guest, Donnie Green, who is the director of the North Central Texas Aging and Area Agency on Aging and the Aging and Disability Resource Center, give us information on a local program.
Thank you, Melinda. And actually, the program was developed nationally by the University of Washington, and area agencies on aging throughout the country have the option of supporting the PEARLS program. It's not necessarily widely available, however, and in the state of Texas, the Dallas-Fort Worth area has really good coverage. So for those who are joining from the Metroplex, please consider this program. So this is an evidence-based program that was developed specifically for older adults, and more specifically those who may be isolated. And it's a program that is provided at no charge to people who are at least 60 years old. It's not contingent on any insurance coverage. So it would be available to people with and without Medicare, those with and without other types of insurance. And it works well as a standalone intervention for people who are dealing with depression or persistent sadness, but it also works well as an adjunct to medication therapy and talk therapy. So the program consists of 6 to 8 sessions, which take place generally over the course of 6 months. And the purpose of the program is to have the counselor engage participants to develop action plans for doing things that they enjoy. Melinda, if we can go to the next slide. So again, in the Metroplex, pretty widely available. We fund it through the North Central Texas Area Agency on Aging. The Community Council of Greater Dallas offers the program to older Dallas County residents. And the Women's Center in Tarrant County supports the program with some funding from the Tarrant Area Agency on Aging. So again, what you need to keep in mind is that this is a program that is available at no cost, not contingent on insurance. And if you're in the state of Texas, you can reach your area agency on aging at 800-252-9240. Even if Pearls is not available in your area, the Area Agency on Aging is likely to be familiar with other counseling programs. Some area agencies on aging will offer other types of counseling for older adults and family caregivers. They administer the benefits counseling program, so we'll be familiar with Medicare coverage for mental health services. So I'm going to go ahead and conclude my remarks there because I know we have a lot of additional information to cover. So thank you, Melinda.
Thank you so much, Donnie. This is all good information, and sometimes people take good and make it bad. So I am grateful that we have Angel Hanzik from the Senior Medicare Patrol to talk to us about mental health fraud. And so let me give you access so that you are able to advance slides. Are you there?
Perfect. I believe so. Yes, I have access. Okay,
Okay.
wonderful. Well, thank you so much, everybody. It was definitely informative, and these guys are the experts through and through. So thank y'all so much for all that you do. But since it is Mental Health Awareness Month, we are talking about mental health and Medicare fraud and how those two kind of go together. And once again, my name is Angel Hanzik, and I'm the Outreach Manager here at the Texas Senior Medicare Patrol. So let's go ahead and jump into it. And if y'all want to give me time warnings, that's totally fine. I know we're getting a little close. So first of all, the Senior Medicare Patrol, we are a federally funded program, and we here are specific to the state of Texas, hence Texas Senior Medicare Patrol, this side of my head. However, there is one in every single state in the United States, as well as all of the U.S. territories. Okay, so no matter where you are, there is assistance available to you. And what we do here is we recruit and train volunteers and professionals about Medicare fraud and Medicare abuse so that they can go out and educate their communities as well. And we're also a reporting agency. So we do handle any sort of cases. You call in, report any suspected fraud you may be experiencing. We build that case, send it to Medicare, and then also to any other fraud control units that are necessary. So anywhere from local law enforcement all the way up to the FBI. So depending on the case and how it is being, how much we're seeing of it and how many folks are being impacted. So our mission here is to empower and assist Medicare beneficiaries, families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. So this just means that we go out and talk about Medicare fraud all day, every day. So today we are going to learn about how scams actually impact our mental health, the consequences of mental health fraud. We're going to look at some current scams that we've been seeing, and then also talk about preventing, detecting, and reporting fraud. So to start out, please open up your chat boxes, and I will ask for a little bit of engagement today. What is mental health? What does mental health mean to you? What is kind of the definition that pops into our heads whenever we think mental health? And I'll wait, oops. I'll wait and see what we get in the chat. Or you can throw it in the chat, you can put in the Q&A, I'll see either. Our state of being, having a healthy mind. Yes, yes, to both of those, absolutely. Stability, mentally and behaviorally, how I'm doing emotionally. Yes, these are all great. So how the WHO, the WHO, defines mental health is a state of well-being that enables people to cope with life stresses and realize their potential. So of course, life is very difficult. We all run into stresses every single day, but mental health is actually our ability to handle those stresses and continue on with our life. Mental illness is whenever this well-being is actually disturbed, and this changes our mood, it changes our thinking and our behaviors. And so maybe we're now thinking a bit more negatively. We're not getting out of bed. We have a really hard time doing tasks that we used to do before. So mental illness is just changing our ability to cope with those stresses. So actually 1 in 5 American adults will experience mental health issues in a year. And so that does not mean that only 1 in 5 people ever will experience mental health issues, because it may happen to every single one of us. It's just saying in a given year, I may experience it, and the next year, out of that same group of 5 people, my neighbor is experiencing it. So it does actually impact every single one of us in different ways. So luckily, as we covered earlier, Medicare does provide coverage for mental health services that will help us diagnose and treat some of these mental health conditions. Outpatient and inpatient mental health care, psychiatric visits, our annual depression screenings, family counseling. So there are options available out there to help us kind of handle some of those stresses of our daily lives. But scams actually negatively impact our mental health. And I know that is not surprising to anyone. If you have been scammed, it is extremely upsetting. It feels extremely violating. However, 2/3 of folks who have been impacted by scams actually report experiencing severe negative emotional issues. Anxiety, sleep disorders, depression, PTSD. And so it can really, really negatively impact our day-to-day life. These scams actually can create feelings of shame and embarrassment, social isolation. And so now we're not talking about it. We feel bad. We don't want to share with other people because we feel so poorly. And experiencing these scams can actually require us to receive assistance from mental health professionals to try and fix this depression, our paranoia, this anxiety that we're experiencing. But also, folks who have mental health problems are 3 times more likely to be scammed than the rest of the population. Okay, this is because poor mental health actually impairs our decision-making, our impulse control, our motivation, right? We talked about it changes our behaviors. And so we're not actually able to recognize that something is a scam the same way that we would if we were fully healthy and having good mental health. Okay, so we may get that phone call and just immediately give out our information when if we were of clear mind, we would think, hey, this sounds a little sketchy. And like we said a moment ago, poor mental health can cause social isolation. Okay, and we all have that village where we go and we tell everything to. I know I talk to my friends and family pretty often. And, you know, if there's something weird going on, they would say, hey, that phone call that you got, that sounds pretty sketchy, you know. But people who are experiencing poor mental health, they may not have that village, someone to say, hey, I think that's actually a scam. Maybe you shouldn't be giving them your information. And of course, also it creates financial insecurity. Okay. And so that may create some sort of desperation of you get that phone call and it's some sort of get rich quick scheme. We're saying that you can do this thing for extremely low money. It's too good to be true offer. But it sounds great because we don't have the funds to do it normally. And so it feeds into that kind of insecurity. So if you see here, scams cause mental health problems. And if you have mental health problems, you're more likely to be scammed. So now we are in this kind of vicious cycle. So it is really, really important that we lean on our resources and utilize that coverage that Medicare provides so that we can actually get the help that we need and break that cycle. But now, unfortunately, the problem does not stop outside of our mental health facilities. Fraud actually can occur while we're seeking assistance to get some solutions to our mental health problems. So that's what we're going to be talking about today is mental health outpatient fraud. And this happens whenever a mental health provider is fraudulently charging a patient for services that they never received, or they're being charged for more therapy time than they actually received. So being charged for an hour of therapy when you were there for 10 minutes, or being charged for a more expensive service than was actually provided to you. So we're going to look at some common mental health scams that are happening today. So first up, we have false psychiatric evaluation or false group therapy. So let's say you're part of a facility or an organization and they take you on a trip, load everyone up in a van or in a bus, or we go to the community room and we eat together, we play a game, we're doing some sort of activity, but there's actually no mental health professionals present. It's basically just a large socialization hour. And then we get our Medicare summary notices and we're being charged for multiple $100s for a psychiatric evaluation. So if there's no mental health professionals present, how can I be being psychiatrically evaluated or be having group therapy if there's no one actually there facilitating that? Okay, so this is an example of being charged for services that were never received. So an actual case that happened very recently was an Illinois psychologist was actually taken to court for Medicare fraud because they were charging patients for in-person services while he was traveling outside of the United States. So he was, running around Europe saying that he had patients in his office receiving therapy, and obviously that was not happening. And even worse, he was charging patients who were deceased for therapy services. And of course, you're not able to receive services if you are passed away. So luckily, he was sentenced in 2023 and he is serving 10 years in prison. A lot of times we hear about fraud and nothing ever happens. Luckily, yes, this man was caught and he is serving time. Next, unfortunately, there are nursing home mental health scams. So I really want to encourage everyone to check in on your loved ones in nursing homes. A lot of times folks in nursing homes are being overlooked. There's not someone there who's making sure that they are receiving the services that they should be, and that they're being charged correctly. And so oftentimes mental health services are being charged to these folks that are never being provided. So another real case that we have seen is there was a resident psychologist for a nursing home over in Connecticut who was actually kicked out from the Medicare program. Medicare said you are no longer allowed to be part of our program because of fraud allegations. And so what this psychologist was doing is he was actually charging Medicare for mental health services to many of the nursing home residents that obviously he was not providing. And he defrauded Medicare for over $2.5 million. Now that is a lot of mental health services that were not provided. Okay, so please just check in on our loved ones in nursing homes and ensure that they are actually getting the care that they are saying that they are receiving. And finally, falsifying records. We have to ensure that our records are accurate because professionals sometimes do falsify patient records, create a false diagnosis so that they can get more money from you and from Medicare. So they may create false diagnoses or manipulate records to show that you have different symptoms than you're actually experiencing. They'll prescribe medications to you that are completely unnecessary or enroll you in a treatment program that you're not actually eligible for. Okay, so the real case that we have here is San Francisco. A psychiatrist actually pled guilty for falsifying records and providing false diagnoses. He was incorrectly diagnosing USPS employees, saying that they had severe mental health disorders, that they were disabled, and that they were experiencing PTSD and other psychological disorders, which means that he was defrauding Medicare, getting his payments, but also he was getting folks to get onto disability whenever they were not actually disabled. So he was defrauding other federal programs as well. So he was taking a lot of money from our federal government. And also a happy ending, he was sentenced to 120 days in prison, and he was forced to repay $1.4 million. I know that is music to some people's ears because a lot of times we don't get that money back. But in a couple of these cases, we did see that money come back in. Okay, and so I'm going to ask you one more time to open up your chat boxes. How do you think we can destigmatize mental health and the shame that comes around being scammed? It really is important for us to stop scams and erase the stigma that is out there around mental health and about being scammed. So how do you think that we can destigmatize that and reduce the shame? Charlie says, let's talk more about it. Yes, 100%. Understanding more, honest education and normalization. These are all perfect, absolutely. The only way that we can destigmatize it is by talking to other folks about it and saying, this is not a bad thing. It's not embarrassing to be scammed. It's not embarrassing to have mental health issues. It's very, very normal, right? We said 20% of Americans right now in this year will experience mental health issues, okay? And so many of us have been scammed. I got a scam email this morning saying that I have purchased Bitcoin through my PayPal. You know, so it does happen to every single one of us, and we just really have to use more inclusive language and be more open to discussing these things with one another. I see a lot of encouraging patients not to blame themselves for the negative actions of others. Yes, 100%, Karen, 100%. It is not embarrassing to be scammed, but it is embarrassing to be a scammer. That is so, so wrong. Absolutely. So now I will go in really quick about how we are trying to stop the amount of fraud, error, and abuse that's happening out there. So what we do here at the Senior Medicare Patrol is we provide free education about Medicare fraud, and our tagline is to prevent, detect, and report healthcare fraud. So of course, the easiest way to handle fraud is to prevent it from happening in the first place. And so that means treating our Medicare card like we treat our credit card. Not sharing that information with anyone, keeping it safe and hidden, not giving out our number to anyone except for our doctor or other trusted provider, okay? Not carrying our Medicare card unless we're gonna need it, leaving it at home with our Social Security card unless we're going to a doctor or some healthcare appointment. Knowing that Medicare is not gonna call us or visit us to sell us anything ever, okay? If Medicare is calling, it's a scam. Any offers of free medical services, we should be super, super wary because nothing in life is free. Watch out for identity theft. Any tactics that we're employing to protect our regular identity, we should use for our medical identity as well. And then also what we said earlier, pass it on, educate, chat with others about it. So share this information as much as possible. Okay, next for detect, we really, really encourage people to read their Medicare summary notices. A lot of folks throw them away, but it's so important to read our Medicare summary notices because there will be a trace of fraud in there. It has to go to Medicare for them to get paid out, and so it will be on our Medicare summary notices if we're being charged inappropriately for services we never received, being charged multiple times for the same service or double billing, or actually being charged for services that were never ordered by your doctor. Okay, you can access this information at medicare.gov. If you throw away your Medicare summary notices and say, I don't like dealing with paper, it's actually available online. Okay, and we do provide healthcare trackers here at the Texas Senior Medicare Patrol. They are a free healthcare journal to write down what happens at your appointments, so you can cross-reference with these statements later on. So if you have any clients, friends, or family members that you think could benefit from keeping a personal record of their healthcare appointments, please reach out to me and I'm more than happy to mail some your way. And finally, report. If you see something, please say something. First, we encourage you to call your provider and say, hey, this looks weird. I don't think I should be being charged for this. What's going on? Because it could just be an error. It could be an accident. So try and call your provider first and see if they can be of assistance. And then if that doesn't work, if they're being sketchy or there's pushback, please gather up all your information and documentation, those Medicare summary notices, your healthcare tracker, any bills, and then call the Texas Senior Medicare Patrol. We are completely toll-free and confidential. And since I've said it's a free service, everybody should say, oh my gosh, she's a scammer. But like I said, we are federally funded, so the service is already paid for. Okay, we also take volunteers. If anyone is interested in sharing this information with their community, we love, love, love volunteers. And also, this is my direct contact information. Once again, I'm Angel Hansick with the Texas Senior Medicare Patrol, the outreach manager here. This is my direct line and my email address. So if y'all ever have any questions, need any materials, please, please, please feel free to reach out. And that is all that I have for y'all today. Whew, I think we're just under the wire for our time limit.
Very good. Very good. Two things. Number one is not only is the services that Angel provides and the Area Agency on Aging already paid for much of with your tax dollars. Much of it's paid for with your tax dollars. But also these scams are that are creating Medicare expenses are also stealing your tax dollars. So make sure you think about it. They're taking it from you, right? They're taking it from all of us. So please don't hesitate to call out to Angel if you see any of this. I'm going to go over the CEU requirements real quick, and then if you have any questions that you want to answer, is that all right, Melinda? Does that work with you?
Sounds good.
Great. For those of you joining us today for CEUs, we're providing complimentary CEUs for licensed social workers and licensed professional counselors in the state of Texas. Those of you that have different licenses within Texas or licenses outside of Texas, you're more than welcome to go through the process, get a certificate. Please note there's no guarantee that those jurisdictions will accept those, but I do know that some have. They also have a certificate of attendance if you're needing one of those. The guidelines are the same for both. Today's webinar is worth 1.5 hours of CEU credits. You must have completed the entire live webinar. Stick with us for another couple of minutes. And you must also complete the Google evaluation survey. When you close out of Zoom today, it should say, would you like to take a short survey? And that's going to take you to our Google survey. If you don't do it there, or if that doesn't pop up for you, no fear. Please look out for my follow-up email that will go out to everyone tomorrow. And that will also have the link to the Google survey as well. The Google survey will be open for 1 week from tomorrow for you to take, and then give us about 4 weeks to get those certificates out to you. If you don't have it by then, feel free to reach out to me. I'm going to turn it over to you guys for answering questions.
All right. Thank you very much. It looks like all the questions have been answered. Felicia, correct me if I'm wrong.
Yes, but there's one in the chat, Angel, and I'm responding to Carmen about it. Is it a question for you or a question for us as benefits counselors?
What's the question?
Illnesses
illness of the brain, of your brain. I believe
Oh, I
that's
believe
right.
they were answering what I was asking
Oh, okay.
about
Thank
mental
you.
health. Yeah.
Okay.
All right. So,
Additionally, I put
Good
in
deal.
the chat a link to the mental health first aid courses that we have going on. I know a lot of people on here are professionals. You guys, these are, I cannot tell you the incredible positive feedback we get from professionals that have gone through the mental health first aid courses. And obviously that has more to do with being Mental Health Awareness Month. But
mhm.
very, very positive feedback we get on these courses. It is a full day course, but it is incredibly valuable.
Very much so. I have taken that course before, and it is very helpful. There's also Mental Health America that has a toolkit that has coping information and resources. So there is a lot of assistance out there as long as someone seeks that, and it's important for our mental health. And like Angel mentioned, just trying to figure out how to remove the stigma from mental health. It doesn't mean a person is crazy. It just means they're going through a time and they need some possibly medical assistance or possibly therapy. And there's nothing wrong with that.
Very good.
All
Well,
right. Well, thank you all so much, especially for Dottie Green for being with us today. We do appreciate you taking the time to present with us. And Angel and Simon, thank you so much for all of the information. And please, everyone, take care of your mental health.
great. Thank you
And
all.
thanks for joining us. Yes.
Yes, thank you all.
Thank
Great
you.
job. Y'all have a
Thank
wonderful day.
you.
Take care.
Thank you.
Bye bye.
Bye-bye.